We are joined now by Dr. Katherine McHugh to talk about maternal mortality and patient advocacy, which has been one of ACOG's major initiatives in the past year. Dr. McHugh, thank you for joining us.
It's a pleasure. Thanks for having me.
So let's talk a little bit about the Prevent Maternal Deaths Act. That's from 2018. I know there's issues on the state level and the federal level with the CDC. Bring us up to date on that.
This is such an exciting initiative and was a huge priority of Dr. Ollier's this past year. This initiative means that not only on the state level but on the federal level we'll be able to study maternal mortality, why it happens, and what we can do to prevent it. The federal legislation that was passed at the end of last year was the key piece that we need because it mandates that all states will have not only those review committees to study that, but also the funding that is needed to do that. These committees are peer protected, meaning that they're not discoverable by lawyers or anybody else that might want to use it for any other reason than just education and preventing further bad outcomes or other maternal morbidity or mortality. These committees are made up of lots of different kinds of people, physicians, nurses, social work, all kinds of different people that will work together as a team all over the country to reduce maternal mortality in America.
It's fascinating. How long does it take to get data that you can use, though? There's a lot of details out there.
There is a lot of detail, and there are so many contributors to maternal mortality. These are the things that we just don't know. So this is why it's so important to study this, to study every single death that happens, to know how we can prevent that in the future.
What are the biggest barriers to advancing more on this issue?
Some of the barriers are just putting these things into place. Now that we have funding for it, now that we have a mandate that every state will have one of these committees, that is a huge gain in this movement, but there's still all kinds of things that we need to do. We need to identify the right people, include the appropriate stakeholders, and that includes the patients. We need to understand who these people are and why they are experiencing these outcomes. Why aren't we, as obstetricians and gynecologists, able to prevent this? And how are we going to change our practices in the future to make that difference?
All right, so advocacy is important with something like this, but it's kind of hard for people to know how to get involved, what to do. What do you suggest?
Advocacy is so important to all physicians, to all people, to all patients, but especially in the world of OBGYN, advocacy is part of our core mission. Advocacy is something that can range from getting federal legislation passed all the way to being in an exam room with a patient and talking to her about her individual risks and what we can do to mitigate those risks. All of that is advocacy. Advocacy includes finding transportation for your patients to get to her clinic appointment. It includes making sure that she and her family have enough food to eat and have access to the resources that are available. All of this is advocacy. So my argument is that all of us are already doing so much advocacy, and it's just taking another step to make sure that all of the women, all of our patients benefit from that advocacy.
So where would you like to be 5 years from now? Where would you like to see this?
In 5 years, we should have so much good information, so much data, and we should really be starting the process of implementing the changes that will result in fewer maternal deaths, result in more moms going home with their babies, and healthier and better families.
That would be a wonderful goal.
Yeah.
Dr. McHugh, thank you so much for joining us.
Oh, it was a pleasure. Thank you for having me.
ACOG TV has all the coverage you want with the big events and key newsmakers. Be sure to check out our content, which is updated each day here on YouTube from the ACOG 2019 meeting here in Nashville.